Ever wondered what chronic respiratory diseases are and how they affect us? Chronic respiratory diseases, or CRDs, are long-term ailments that target the airways and other parts of the lung. They can significantly impact a person's health and daily life, making simple tasks like walking or even breathing a challenge. These are not fleeting illnesses, but persistent conditions, often requiring ongoing management to keep symptoms at bay. Now that we've covered the basics, let's dive into the common types of these diseases. You may have heard of COPD and asthma, but do you know what they really are? Let's delve into it. Chronic obstructive pulmonary disease, or COPD, is a group of progressive lung diseases, including emphysema and chronic bronchitis. It's characterized by increasing breathlessness and leads to a decreased ability to perform physical activities over time. On the other hand, asthma is a condition in which your airways narrow and swell, producing extra mucus. This can make breathing difficult and trigger coughing, wheezing, and shortness of breath. Unlike COPD, asthma is often reversible, but in severe cases it can cause lasting damage to the airways. Both COPD and asthma affect the respiratory system, limiting the flow of air in and out of the lungs. This disruption can have significant impacts on a person's quality of life, affecting everything from daily tasks to sleep patterns. Now you're probably wondering, what causes these diseases and who is at risk? It's crucial to understand the causes and risk factors of chronic respiratory diseases. Let's unravel these together. The primary culprit is, unsurprisingly, smoking. Both first and second-hand smoke can cause considerable damage to your lungs, leading to diseases like COPD and asthma. However, it's not just smoking that's to blame. Exposure to various environmental pollutants such as dust, chemical fumes, and air pollution can also contribute significantly to the development of these conditions. In addition, certain occupational hazards like working in an environment with heavy dust or chemical exposure can increase the risk. Now, let's not forget our genes. A genetic predisposition, meaning it runs in your family, can make you more susceptible to these diseases. But remember, just because you're at risk doesn't mean it's a certainty. Many factors interact in complex ways to cause these diseases. Understanding the symptoms and how these diseases are diagnosed is the next step in our journey. Recognizing the symptoms and getting a diagnosis are the first steps towards treatment. Chronic respiratory diseases, or CRDs, often present symptoms such as shortness of breath, chronic cough, and chest tightness. If you experience these persistently, it's paramount to seek medical advice. In diagnosing CRDs, doctors typically conduct a physical exam, review your medical history, and order tests such as spirometry, which measures how much air you can breathe in and out. Imaging tests like X-rays or CT scans can also be used to look for signs of lung damage. Once diagnosed, treatment begins. The goal is to manage symptoms, slow the progression of the disease, and improve quality of life. Medication forms a significant part of this treatment. Let's highlight the top 10 medications often recommended. Bronchodilators such as albuterol and salmeterol help to relax the muscles around the airways. Inhaled corticosteroids like fluticasone and budesonide reduce inflammation in the lungs. Combination inhalers, oral corticosteroids, and leukotriene modifiers are also often used. Phosphodiesterase 4 inhibitors like roflumilast can help reduce flare-ups in severe COPD. Mucolytics such as acetylcysteine help to thin mucus in the lungs, making it easier to cough out. Sometimes antibiotics are needed to treat infections. Oxygen therapy and pulmonary rehabilitation also form part of the treatment plan for some patients. While medication is crucial, lifestyle changes can also play a significant role in managing these diseases. Lifestyle changes and prevention measures can go a long way in managing chronic respiratory diseases. One of the most impactful changes is to quit smoking. Smoking is a primary cause of many respiratory diseases, so giving up this habit can dramatically reduce your risk. Another key to maintaining healthy lungs is regular exercise. Physical activity can help to strengthen your lungs and keep them functioning optimally. A healthy diet also plays a crucial role. Consuming a variety of fruits and vegetables, lean proteins, and whole grains can provide your body with the nutrients it needs to support lung health. In addition to these lifestyle changes, it's important to seek medical advice if you experience any symptoms related to chronic respiratory diseases. This could include persistent coughing, shortness of breath, or chest discomfort. Remember, early detection and treatment can make a significant difference. Stay healthy and take care of your lungs.